The Dutch test is going to help your practitioner understand what's happening with reproductive hormones as well as stress hormones. In your Dutch test kit, you'll see that, of course, you have the container it came in, as well as an instruction information booklet. There is a requisition form. You have 4 little cards for urine collection. You have 5 saliva collection tubes. And in fact, you have 6 because there is one extra that sits in a separate bag. That one is only to be used by patients who are doing the extended test if they have insomnia. And there's an Australia Post Express Post bag. With those collection tubes and the cards, if you have a look at them, you'll see that each of them has a number on them. So there is an order in which to do your collection. And every time you do a collection, you're going to pop your details on each of those cards. But we'll cover that in more detail in a moment. Now, for those who do still have a cycle and they're trying to figure out when on earth can I do this test? Well, it's a little bit nuanced and it will be very much between yourself and your team to figure out the best day for testing or days for testing. If you have a regular 28-day cycle, you will be testing somewhere between days 19 to 22. If your period is longer, so for example, if you have a regular 30-day cycle, you just add those extra 2 days on. So then you might do this test between days 21 and 24. If, however, you're just not sure, for whatever reason your period is less predictable, then you'll test for ovulation using ovulation test strips. Your health coach can organise those for you. And you can test the Dutch 7 days after a positive ovulation test. Preparation for this test, there is a little bit to do. So for 2 days prior, just avoid bananas, avocado, and fava bean. There are some supplements you'll see listed here that need to be avoided. And for 24 hours before, and also for the whole duration of the test taking time, you need to limit your intake of fluids. They do want a concentrated sample, ideally. How to collect your samples. The saliva collections, all you'll do is take the little blue tip off the plastic container, tip the little cotton swab into your mouth, and basically just hold it in your mouth and move it around until it's really saturated with saliva. You do not need to spit into the test tube. Once you've finished and it's really nice and wet, so it might be in your mouth for 1 or 2 minutes perhaps, just pop the little tube back up to your mouth and then kind of spit it back into the container. Pop the lid on it. Please immediately write your name and the time of collection onto the tube, and it goes straight into the freezer where it stays until postage. The urine collection is it's that little bit of cardboard. You'll see that there's a slightly different looking piece of card in the middle of that card once you open it up. And it's got 2 little lines on it. So the way you can do this test, you really have 2 options. So you can urinate directly onto that little test strip, or you might collect it into some sort of container and then you can dip it in, dip that little test strip into the urine in the container and then discard the urine. Again, we want to know exactly the time that you collected that. And then all you need to do is pop that card on a windowsill or a shelf or somewhere that's warm and dry, somewhere where it won't get knocked or bumped, and it will need to stay out until it's completely dry. So depending on the temperature and the climate, somewhere between sort of 24 to 48 hours typically. On test day, all right, so here's the process for test day. The morning's going to be busy, but you'll find the rest of the day actually very manageable. So as soon as you wake up, within a few minutes of actually waking, go straight to the bathroom, do a urine collection, and also do a saliva collection. From that moment, 30 minutes later, you'll do another saliva collection. 30 minutes later, you'll do another saliva collection. So, for example, if you wake up at 7 a.m., you do your urine and saliva at 7 a.m., you would do your next saliva at 7:30, and you would do your next saliva at 8 a.m. So they're all collected within that 1 hour time frame at 30-minute intervals. During that time, please do not eat and also don't brush or floss your teeth. Then 2 to 3 hours after waking, you do have another urine collection to do. So again, if you woke up at 7, you'd be testing this one between 9 and 10 in the morning. Then, go about your day. So everything you can just keep doing as normal with a few exceptions. I'll talk about them next. And then at around about 4 p.m., we'll need to do the next of both saliva and urine. For an hour before that, no food or drink. And about 10 minutes before you do that test, just swish some water through your mouth. It's probably easiest just to set a timer on your clock so that you get an alert for that. The next sample is taken sometime between 10 and midnight, and that's your last collection for the day. So the conditions for this actually, you are not to drink any alcohol or caffeine. You also cannot do any exercise, and you have a maximum of 1 litre of water for the day. So those things are actually really important. Once you have posted, you can actually send this any day of the week. So as soon as those urine samples are dry, then get your samples out of your freezer. You can put all the saliva ones back into the little plastic bag, and you can also put your dried urine samples into their clear little plastic bag. You can go back to eating your normal diet, and these results do take about 4 weeks to come back.